Meet Justin. He's on workers' compensation after being injured at work and is unable to perform his regular duties or participate in daily life as he once did. Whilst recovering from the physical impacts of his injury, Justin is starting to show signs that affect his mental health, which left unchecked could develop into a secondary psychological condition. And the longer Justin takes to recover or is away from his workplace, the more likely he is to experience symptoms of a psychological condition impacting his overall recovery. But here's the tricky part. The symptoms of a psychological condition often develop slowly over a period of time, making it difficult for the worker to recognise until a psychological condition is fully developed. This is why it's absolutely crucial for employers, friends and family to be on the lookout for signs of a psychological condition during a worker's recovery period. So, what are some of the signs employers should keep an eye out for? 1. Changes in behaviour, including changes in routine. 2. Decreased personal care. 3. High levels of irritability or aggression. And 4. Reduced activity or motivation. The sooner the signs of a developing mental health condition are recognised, the sooner steps can be taken to prevent it. And what about Justin? What symptoms should he look out for? 1. Feelings of social isolation, even when in the company of others. 2. Frustration due to the impaired ability to perform daily tasks most of us take for granted. And 3. Anxiety, caused by excessive worrying about the future. If left unchecked, these symptoms are likely to get worse over time, making treatment more difficult to address. But it doesn't have to be this way. By addressing the symptoms early and seeking assistance where needed, the risk of developing a secondary psychological condition whilst on workers' compensation can be reduced. So what can workers like Justin and their employers do to minimise the risk of developing a secondary psychological condition? Employers should implement strategies to ensure workers feel connected with the workplace, even when they're not physically there. Whilst workers should recognise that their mental health may have changed from its normal baseline, and in doing so, begin to challenge any negative self-talk, focusing on what they can do rather than what they can't. Justin should reach out to his support network if he starts to struggle with his mental health. The support network includes the Employee Assistance Program, doctors, friends and family, Lifeline, or Coal Mines Insurance. Coal Mines Insurance adopts a person-centred approach to assist workers who experience the symptoms of a psychological condition. CMI can help workers and employers by consulting with treatment providers, coordinating referrals for psychological treatment, providing extra assistance for return to work, and by listening to your workers' concerns. For more information about mental health or how to help your workers stay mentally fit during recovery, please contact your account manager or call CMI on 1800-WORKER or Mates in Mining and Energy on 1300 642 111.